So this is the physician fee schedule for 2024. Really important. Every year this comes out around November timeframe. If you remember, I did something like this back in the summertime when that was just a proposal. So now this is the final rule. And so there have been some changes, quite frankly, things that we talked about previously that you need to be aware of as you gear up for how you're going to bill for some of your services, especially in the remote care programs. We talked about this before around remote patient monitoring, chronic care management. Those are going to be changing due to some reimbursement changes that CMS is interacting here in the next couple of weeks. So want to give you guys an update on that. So today we're going to discuss the final rule released by the Centers for Medicare Medicaid Services, or CMS. This was recently this November in 2023. The focus will be on the remote care program. So remote patient monitoring, chronic care management, and some new ones that were just announced recently that we'll get into why they're important, how you can utilize them. And also discuss, like I mentioned here, the new CPT codes that have been announced. So this will be go into effect January 1st, 2024. So that's something you need to be aware of. Here's a disclaimer. Again, please, anything we talk about today, please reach out to your legal team as well as your billing team to get corrections or understanding how it works specifically for your practice. This is just a general overview for educational purposes only and not to be taken as direct advice. The bad reimbursement changes. It's official. CMS will be cutting your reimbursement. So in the final physician fee schedule, there will be a 3.4% cut to the conversion factor from 2023. So overall, 1.25% cut in reimbursement. If you look at this over a decade, this has been a steady launch of reduction in your reimbursement for the last 10 years, 22% overall. So you've seen CMS is really looking at how they can take away some of the fee-for-service revenue model and move it over into these value-based care, remote care models. So this is the trend. So either you ride the wave or you end up being drowned by the wave. So my high recommendation is to ride the wave and go forward with these programs that they're putting in your place so you can be successful as you deliver care for your patients. While 1.25% may not seem a lot, but we're raising inflation and wage growth. If you run a gut company, your business, the margins for a lot of independent physician groups are very thin. This can hurt. So definitely take advantage of these programs that now that you have a chance and really unpack them so you can hit the ground running in 2024. If you're a FQHC, Federally Qualified Health Center, or Rural Health Center, RHC, there's ability to bill for new codes. And also there are new codes that you can take advantage of that will help you for this new normal. First, before, chronic care management has been dealing with FQHCs as well as rural health centers since 2019. It was under the G code, the G0511 CP code that was created back in 2019. Typically, this was reimbursed one time per month for 20 minutes of clinical staff using the code to help with the patient around the care plan, understanding what the patient's doing. And you were able to bill for this every month as a FQHC or RHC. This is great, but unfortunately there was, since 2019, we've had other codes that deal with remote monitoring or remote care, such as remote patient monitoring, remote therapeutic monitoring, principal care monitoring, tons of other ones that we're going to talk about today as well. But there were no codes at all for this. Well, CMS has decided to change that. So now, and again, like I said, this code right here, this CCM code, billable G0511 up to 20 minutes at a minimum, but you can do 40, 60 minutes. But average, they were going to pay out roughly about $70 per month for these type of services. But what's happening now is CMS has decided that they will go ahead and lower your reimbursement for chronic care management. So instead of $78, it's down to $73, which is a $5 reduction on this monthly fee. And then the minimum 20 minutes of clinical staff will be required. But now HCPS G code can be billed multiple times per month. So that means you'll be able to add other different remote care services, right? So again, you were billing it one time, only CCM. Now CMS is allowing you to bill that G code multiple times per month. So now you can add other services to that. Questions though have arose already, even after the final rule was announced. How many times can you bill this G0511 code, right? We know for a fact it can be a minimum of 2, and I'll show you that in a second. But can we bill a setup fee for RPM? If you're familiar with RPM, there's an initial code 99453 that allows you to get compensated, not much, but something to get started from a training standpoint, patient getting things up and running. Is there a startup fee like that for FQHCs and RHCs? So we need to get more clarification on that. So our recommendation is try it out with a few in January, see how that process works, and then we'll have more indications. I'm assuming that CMS will probably create some kind of notices that they'll send out prior to January 1st to give us more clarification on that. But more to come on that. Speak to your legal team and your billing team as to the changes and when that will occur for you as well. So how is this looking from a billing standpoint? So basically, like I mentioned before, you were getting the CCM patient information of $78 per month. Now in 2024, you'll be able to bill CCM and RPM. So remember, it's going to be broken up. So now you have your base monthly RPM. So typically this monthly fee in traditional terms is broken into 2 reimbursement codes, 99454, which is the device fee, and 99457, which is the clinical staff total. What they're saying is that, hey, in 1 month, you're going to be paid one time for an RPM-like service. So that could include the device information, the collecting device data, and the clinical time, all rolled into one, and that'll be reimbursed about $73. Also, since you can do RPM and CCM at the same time, if you're already doing chronic care management, if you do 20 minutes with the patient for CCM, you also get compensated for $73. So if you put that together, that's a total of $146 that can be reimbursable. So a lot of different scenarios here, but the thing is, if you're already doing CCM, $73 now, decide to do RPM, you have a patient device, and don't do any other services beyond that, you can still bill out the $73 as long as the patient has 16 days or more reading with that medical device. So just something to think about as you look to ramp up in there. And again, the one in the middle here, that first month, that initial enrollment, we're still unknown on how much CMS will compensate for that, or if at all. So be on the lookout for that notification. So hopefully that's clear. If you have any questions about that, let's cover that later. But that's what's happening for the RPM. They're allowing you now to bill an RPM type code under the G code. So it'll be multiple G codes, G0511 codes that you can now bill per patient per month. And to even make it even more confusing, thanks to CMS, they will allow you to bill all these different types of services. So again, we know for a fact there's 2 per patient that you can do every month. We just need clarification on how many of those G0511 codes you can do. There's rumors that it's probably going to be based on a category setups. This is the remote patient monitoring, or RTM, remote therapeutic monitoring. So that way it's clear, so you're not confused, and CMS is not confused as to what service you're actually providing to this patient, since it's under that umbrella or that general code for FQHCs and RHCs. Again, this is for FQHCs and RHCs only. For traditional reimbursement, 99457, 453, 54, 58, that stays the same. That has not changed, just for FQHCs and RHCs. And again, all these different virtual care services can be provided under this G code, but we need clarification on how many times can you bill that G code, because we can add multiple care management programs to each patient.
Hey everyone, I want to take the time to let you know how we can help you and your organization navigate the coming changes to your practices. Please join our monthly webinar on how virtual care programs will transform the management of your medical practice. In this informative webinar, you will learn our proven system on how not to miss out on any billable value-based codes, how to scale your team to handle new workflows without burnout, and the onboarding experience for value-based care programs that produce the best patient care. So if you want to learn more, click on the link below and sign up today.
The physician fee schedule final rule, which is over 2,000 pages. You can read through it in the Federal Register to get more details, but also talk to your legal team. They can give you the latest and greatest. But hopefully you enjoyed this time. Hopefully it was insightful. If you have any questions, don't hesitate to reach us at sensormed.com, and looking forward to seeing you in 2024. Have a good one. Take care.